are going to be your nurse today.
Hi.
How are you feeling?
Good.
Good, okay. I'm just here to do a quick head to toe assessment on you. It'll take about 20 minutes.
Okay.
Super easy. Can I get your name and your date of birth?
Mackenzie Delozier, 1-3-2000.
Okay. So first I'm going to start with the general survey. Start with age. She appears to be the age that she stated. She said she was born in 2000, so that makes her 20 years old, and that adds up. Next is level of consciousness. Okay, do you know who you are?
Yep, Mackenzie.
Okay, do you know where you are?
I'm at the doctor. Oh, I'm getting assessed by the nurse.
Okay, yeah, so that's what you're doing. And then, do you know what day it is?
Yes, November 22nd, 2020.
Awesome. Okay, so she's alert and oriented. Next, her skin. Her skin looks even in tone. It's pink. Her texture is smooth. She has no abnormal lesions. It's not dry. Can I see your back of your hand really quick? I'm gonna test your skin turgor. Turgor is good, so that's awesome. Next is your nutritional status. So she appears to be of a good weight for her height and her body mass. Her weight appears to be distributed evenly. Next, I would weigh her and also check or add up her BMI. How many meals do you eat a day usually?
Probably like 2 good ones. I don't usually eat breakfast, but I do eat lunch and dinner.
Okay. And what would you say your diet consists of?
Just kind of like an average normal diet, I guess. I eat vegetables, I eat fruit, so.
Okay, that's awesome. Next is position and posture. So her posture seems good. She's sitting erect. She's not hunched over. Her spine seems straight. For position, she seems relaxed and comfortable, so that's awesome. You don't have any obvious abnormalities, so that's really great. For mobility, can I have you stand up and then walk to the wall and back for me really quick?
Yep.
Perfect. So her gait seems smooth and even. She doesn't have any troubles with balance. She also doesn't have any issues with involuntary movements. So that's really great. Doesn't have so next I would assess your facial expression. Her facial expression is good. Her facial expression is good. She's making eye contact. And her expression matches the scenario that we're in, so that's great. Her mood and affect is good. She's being very personable. She's being very cooperative. She seems relaxed, so that's really good as well. Next is her speech. So her speech seems to be good. She's articulating well with me. It's smooth and she's fluent, so that's good. Her hearing seems to be good. She's been able to understand everything I'm saying, and she hasn't had any difficulties with that, so that's awesome. Personal hygiene. Her hygiene seems good. She's clean, she's groomed well, and it looks like she takes care of herself well, so that's awesome. Next, I'm going to do your vital signs. You get your temperature. Maybe 97.4, that's awesome. I'm going to assess your pulse, so it'll just take a minute, okay? Okay, so her pulse is 62, that's really good, and her respirations were 18, so that's good as well. Next, I would check her blood pressure. If I had a cuff, I would put it on her upper arm and also take it with my stethoscope. I would also make sure she's in a relaxed position and not crossing her legs. Next, are you feeling any pain at all today?
No.
No? Okay, so on a scale from 0 to 10, 0 being none and 10 being the worst pain, how would you?
0.
0, okay. So if she had said yes to having pain, I would ask about the quality and characteristics of her pain. Next, I'm going to do the neurologic assessment. So have you had any head injuries?
Nope.
Have you ever had any seizures?
Mm-mm.
Any trouble with coordination?
No.
Any like extreme weakness?
No.
Any like tingling or?
No.
No? Okay. So I'm going to, I already assessed her level of consciousness. She was alert and oriented. I would also, if she had said yes to any of those, I would dive deeper and check her different cranial nerves and also her motor systems to make sure that there's nothing wrong in those areas. The next thing I'm going to do is assess your head and your face. So have you ever had any frequent or unusual headaches?
No.
Any dizziness? Any surgeries on your head or your face? No? Okay, so I'm going to palpate your head. Her head size and shape is normal. Her hair is thick and smooth and distributed evenly across her head. She doesn't have any lesions or bumps on her head at all. She has good facial symmetry. There's no drooping or anything like that. I'm going to palpate your lymph nodes. Lymph nodes are non-palpable, so that's good. Next, I'm going to assess your eyes. So, do you ever have any pain in your eyes?
No.
Have you ever had any surgeries?
No.
Do you wear contacts or lenses?
Yes.
Okay. Do you ever have any like blurring with your vision?
No.
Okay. Have you ever, do your eyes ever get dry at all?
No.
Or like do you ever get like watery, teary eyes for no reason?
No.
Any pain in your eyes ever? No? Okay, so I'm going to inspect now. Her eyebrows are symmetrical and they move symmetrically, evenly. Her eyelids are also symmetrical. They don't droop at all. They completely close with her lower eyelids when she blinks, and there's no like skin lesions or anything. Her eyelashes are distributed equally across her eye or her eyelid. I'm going to have you look up with your eyes. I'm going to pull down on your bottom eyelids just a little bit. Okay, so her conjunctiva are clear. She also, you can see the blood vessels, and her sclera is white. Your iris and pupils are round. They're equal in size, and they're even in color, so that's really good. I'm going to assess your eye muscles, so I'm just going to have you keep your head straight, but like move your eyes wherever the pen goes. So. Awesome. Her eyes moved smoothly with the pen in all directions, and there was no difficulty with that. So I'm going to shine this light in your face, or in your eyes, and you just keep looking straight at my face, okay? Okay. Awesome. Okay. Now I'm going to hold this pen away from you and bring it closer to your face. Just keep your eye on the pen. Awesome. So our pupils are equal, round, reactive to light, and accommodating. That's really good. Next, I'm going to assess your ears. So do you ever get any earaches?
No.
No? Any discharge from your ears? Any pain in your ears?
No.
Do you get infections in your ears a lot or ever? Yeah, okay. So next I'm going to inspect her ears, make sure, okay, her ears are symmetrical. She does have piercings. They don't appear to be like infected or irritated at all. Her ears are symmetrical. They're the right size and shape for her head. They're the same color as her face, which is awesome. I'm going to just like touch your ears and pull on them a little bit. Tell me if you feel any pain. No? Okay, so no pain. That's really good. Then I would inspect her inner ears with an otoscope. I would check her ear canals to make sure they're pink, make sure there's no drainage or swelling. I would make sure that there's no earwax like covering over her eardrum. I would make sure that her tympanic membrane is shiny and translucent. Next thing I'm going to assess is your nose. So do you ever get any nasal drainage? Any signs frequent or severe nosebleeds?
No.
Okay, so I'm gonna inspect your nose. Her nose is symmetrical. It's midline in her face, centered. There's no abnormal lesions or anything. I'm going to press on each of your nostrils and just breathe in for me. Okay. The patency of her nasal passages are really good, so that's awesome. I'm going to palpate your sinuses. Tell me if you feel any pain or tenderness. No pain?
Nope.
Okay, awesome. So that's perfect. I'm going to move on to your mouth and your throat now.
Okay.
Do you ever get any sores in your mouth or your throat?
No.
Do your gums ever bleed?
No.
Any toothaches ever?
No.
Any difficulty swallowing at all? No? Okay, so her lips look good. They're equal. The color is even, and there's no cracks or lesions on her lips. I'm going to check your buccal mucosa. I usually do this with a tongue depressor, but since I don't have one, I'm just going to have you pull open your cheek for me and open your mouth. Yep, so her buccal mucosa is pink, it's moist, there's no lesions. That's really good. Can I see your teeth? Okay, her teeth are white, they're clean, they're straight, there's no uneven gapping, you're not missing any teeth. Can I see your gums? Can you pull down your bottom lip? Okay, her gums are pink. They're not swollen, there's no retractions, that's really good. Can you stick out your tongue for me? Perfect, your tongue is equal, it's symmetrical, moist, there's no lesions on it, that's awesome. Okay, next I'm gonna move on to your neck. So, do you ever get any pain in your neck?
No.
Have you ever had any surgeries in your neck? Okay, so the first thing I'm going to do is I'm going to just inspect. Her neck is symmetrical on both sides. It is midline, it's holding her head midline, and her neck muscles are holding her head up erect. It's really good. Next, I'm going to palpate your lymph nodes. And then your collarbone lymph nodes. Okay, lymph nodes are non-palpable. That's really good. I'm going to check your carotid pulse really quick. Carotid pulse is 2+, equal bilaterally. The rate and rhythm are equal as well, so that's really good. I'm going to check your throat or trachea. Okay, so I'm just going to push on your trachea a little. Trachea is midline. There's no masses pulling it or pushing it in either direction, so that's really good. Next, I'm going to check your range of motion. So can I have you put your head down? Up, to the right, to the left, and then can you shrug your shoulders against my hands? Awesome. So she has full range of motion and strength in her neck as well, so that's perfect. Next, I'm going to move on to your chest. So do you ever have any chest pain?
No.
Any cough, shortness of breath? And do you have a history of smoking?
No.
Okay. So I'm going to have you turn around really quick. Can I just have you turn back that way? Perfect. Okay, so the first thing I'm going to do, is it okay if I lift your shirt up a little?
Yep.
Okay. So her thoracic cage is symmetrical. There's no skin lesions, no abnormalities with that. Her spine is straight and midline, and her scapula are equal on both sides and symmetrical. So that's really good. I'm going to check for thoracic expansion. So, yeah. Okay, so take a deep breath for me. Okay, so she has symmetrical chest expansion on both sides. That's really good. I'm going to listen to your lung sounds. I'm going to have you take deep breaths. Just let me know if you start to get dizzy or anything. Okay? Okay. Her lungs sound clear. Maybe turn back towards me. Assess your respirations. So respirations seem normal. They seem normal this whole time. They're relaxed. You're not using your accessory muscles, and I can't hear you breathing, so that's really good. I'm going to listen to the lung sounds on the front of you now. I would normally go under the shirt for this, but for this exam, I'm not going to do that. Okay, just take deep breaths again, and if you start to feel dizzy, just let me know. Lungs sound clear. Next I'm going to assess your heart. So do you ever have any chest pain with your heart?
No.
Do you have a history of heart disease?
No.
Any surgeries with your heart?
No.
Do you ever get any swelling in your legs or your feet?
No.
No? Okay, so I'm going to listen to your heart sounds.
Okay.
I'm going to listen. It's going to seem like I'm listening for quite a while, but that's normal. I would also do this under the shirt usually, but for this example, I'm not going to. I'll just have you sit up straight for me. Okay. Do you want to, can you like see all the different, okay. So I was able to hear the heart sounds in all 4 quadrants. You can hear the S1 and S2 sounds in all 4 spots, and the rate and rhythm are equal and symmetrical in all spots, so that's really good. Next, this is where I would do the breast exam. I'm not going to do that for this assessment, but if I were to, I would check for retractions. I would make sure the skin is even in tone and there's no lesions. I would make sure there's no abnormal discharge. I would also have the patient lie down and do the breast exam. I would palpate in a back and forth motion across the breast and then also palpate into the armpit. Do you do self-breast exams every month?
Yeah.
Yeah, okay, that's awesome. So the best time to do that, I'm sure you know, is when you're in the shower. You only have to do it once a month. It's just checking for any abnormal bumps or lumps that you never felt before. So that's perfect. The next thing I'm going to do is check the upper extremities. So do you have any pain in your arms at all?
No.
Any redness, stiffness, any swelling in your arms at all?
No.
Do you ever feel any like heat in your joints? No? And have you had any accidents or trauma to your arms at all?
No.
No? Okay, so I'm going to first assess your range of motion. So I'm going to just have you copy what I do. Put your arms up like this, down, out like this, down, okay. Back as far as you can. Awesome. And then behind your head like this. Perfect. Can I have you flex your hands for me? And then straight or extend them? Yep. Okay, so then I'm going to have you squeeze my fingers as hard as you can. Awesome. And then pull my hands towards you. Okay, now push my hands away. Awesome. So she has full range of motion and strength in her arms. I'm now going to palpate your pulses on both of your arms. So it'll just take a second. Okay, so so your pulses are 2+ and equal bilaterally. They have symmetrical rate and rhythm, so that's really good. I'm going to assess the ones on your wrist now. Okay, same for the pulses on your wrist, 2+ equal bilaterally. Rate and rhythm is symmetrical on those as well. Can I see your nails really quick? Okay, nails look good, there's no clubbing. Capri feels really good, took less than 3 seconds, so that's awesome. I'm going to assess your abdomen now. So do you have any pain in your stomach ever? Have you had any like sudden weight loss or weight gain?
No.
No? Any changes in your appetite?
No.
Any nausea, vomiting, or diarrhea?
No.
Okay, so can I have you lay down for me?
Yep.
Okay, and then do you want me to come over here? Okay, so I'm just going to assess her abdomen really quick. So her abdomen is symmetrical. The contour is flat, and she has no skin abnormalities, no lesions, nothing like that. I'm going to listen to your bowel sounds really quick. Her bowel sounds are active in all 4 quadrants. I'm going to palpate your abdomen really quick. You tell me if you feel any pain or like tenderness anywhere.
Okay.
Okay. No pain?
No.
Okay. I also didn't feel any rigidity or abnormal masses, so that's really good. You can go ahead and sit back up now. Okay. Now I'm going to assess your lower extremities. So do you have any pain in your legs at all?
No.
Any swelling, redness? Any swelling, redness, swelling, redness? Do you have any heat in your joints at all? Okay, and heat in your joints. Any stiffness?
No.
Okay, so I forgot to do this on the upper extremities, but you would do this on both the upper and lower extremities. So your legs look symmetrical. They are the right size and length for your body. Your arms were symmetrical. They're the right size and length for your body as well. I'm going to have you stand up, and we're going to do some range of motion. Okay, so first I'm going to have you pull both your legs out like this. Okay, and then bring both your knees up to your chest. Okay, put both your legs out to the side. Okay, and then each is back as far as it can go. Okay, you can sit back down now. And have you flex your feet for me, and then straighten them, and then do a little circle. Awesome. So I'm going to have you push against my hands. Awesome. Pull against my hands. Perfect. Okay, so she has full strength and range of motion in her legs as well. I'm going to check the pulses on your feet and on your ankles. So I might have you lie down for this as well, just so I can feel a little easier. They're cold, so. Okay, so the pulses are 2+ again, equal bilaterally, same rate and rhythm. I'm going to test pulses on your feet here. So they're a little difficult to feel. I did get them, they were, have good rate and rhythm. If I was having this difficulty in a hospital, I would get the Doppler out so I could hear them more clearly. You can sit back up now. Range of motion, pulses. That's it for your lower extremities. So this is when I would do the genital and rectum exam. So for the genital exam, I would ask you about your menstrual cycle, your sexual health history. I would ask you about any pain or discomfort while urinating. I would also have you get into the lithotomy position, and I would inspect your skin, labia, urethra, and vaginal opening. I would also palpate. I would inspect the cervix with a speculum and do a pap test to make sure that there was no abnormal cell growth. For the rectum exam, I would ask you about your bowel health, bowel habits, and I would also ask you if you had any pain or bleeding in that area. Then I would have you bend over the table, and I would inspect your perianal area, and I would palpate with a looped finger and check for any abnormal masses in that area as well. So. Our exam is about over. Do you have any questions or concerns for me about anything at all?
No.
No? Okay, well, thank you so much for your time today, and have a nice day, okay?
You too. Thank you.
And,